Hey, this is Dr. Gupta. I'm here with Dr. Rahimi today. We're going to be discussing shoulder reduction, specifically a technique we call the Toga Technique. This is something we've developed, and as a lot of you may know, there's multiple ways to reduce a shoulder. However, this method we personally like because it seems to allow for more control, less tiring out, and more maneuverability because we can use both our arms while putting reduction with our own body weight. So for that, let me go ahead and start showing you what we mean. All right, so for the toga technique, the first off is to get your toga, aka any sort of sheet. What you're going to want to do for this is tie it around your waist and just any simple knot, crossing here, and then to tighten the knot. You want to give yourself a little bit of slack, okay? And from there, we're going to be using this to help produce traction for the patient's shoulder, which we'll go into next. So we're now joined by Dr. Marcy. He's going to be our patient. So his shoulder is out of place, a lot of pain, can't really move it around too much. So what I do is with this sheet, I go ahead and grab it, his arm, put it through. From here, if you look at me, I'm able to put traction on him, control it very well with just my body. I can lean back, I can take a step back, and I have much control of how much traction I want to give him. Get that from a couple angles. And I can stand here, do this for 10, 20 minutes, do notes while I'm waiting for the patient's arm to relax if we really wanted to. We can have someone put a sheet along the patient, perform countertraction, but another part is while I'm in this AC fossa, I have both my hands free to maneuver the patient's hand as I need to, while just using my torso to pull back and create that traction. You can see there's a lot of stretch right there along Dr. Marcy's arm. How's that feel for you?
Great.
Awesome. All right. And with a little bit of time, their muscles will weaken, tire out, and it'll go back in place with very minimal effort. So you don't have to be a large weightlifter for this. Anyone can do this procedure. Okay.
Okay, so here again, as Dr. Gupta did, we're gonna take the sheet, gonna tie a quick small, little knot in there. And usually what we do is I'll take the sheet and move it back this way. And so what we can do is we slip his arm under here. What I'm going to do is lie him flat as well. So we're going to go down. Sorry about your shoulder. I know it hurts. I know it hurts. Someone's holding countertraction. So if you see here, I slip it in. And now I can move. You can do it, put your back into it, kind of thing. And I can control his arm and externally rotate like a joystick without having to tire myself out. And all my traction is happening from my hips and my legs and my waist. And so I'm not having to really hold or do the classic method, which is kind of hold here, you grab and you do the traction. That tires you out quite a bit. And then you have your counter traction guy also pulling, against you, which is a good thing, but also it makes it harder. So this method seems to really take that off, that stress off of you. We've done it in this ER, a few dozen times and with 100% results. So it is another method you can use in your repertoire to reduce a shoulder. And again, it's not the only one. There are, half dozen or so. So this is one that if you keep in the back of your mind as your rescue method, it should work every time.